Hello, today we'll be talking about the standard presentation script for heart murmurs in a short case exam. This serves as a guide and feel free to adapt it to whatever way you like. A short case station is usually 10 minutes long. My advice is to spend up to 5 minutes with your examination and have another 5 minutes to present and answer questions that examiners may have. You may start the presentation with a description of the murmur. If you are less comfortable with presenting a standard script for a specific murmur, you can always tell the examiner what your findings are in the order of these bullets here. Tell the examiner if you think the murmur is systolic or diastolic in nature, timed with respect to the carotid pulse. Do note that in terms of grades of murmur, there are 6 grades for systolic murmurs and only 4 grades for diastolic murmurs. For accentuations, do make a show of the maneuvers, and also remember to ask the patient to take a deep breath in and out, keeping in mind that right-sided murmurs accentuate with inspiration and left-sided murmurs accentuates with expiration. You can use the mnemonic RILE. Here I have summarized some of the features of the commonly tested murmurs. Do take a read. In terms of apex beat, I was often confused between the terms used back here when I first started as a medical student. So just remember that dilatation and displace both starts with a D, while hypertrophy and heaving both starts with H. So when there is hypertrophy, you can feel a heave, as in the parasternal heave in right ventricular hypertrophy and heaving apex beat in left ventricular hypertrophy. On the other hand, dilatation is commonly caused by regurgitation, resulting in a displaced apex beat. The motion if felt should be described as thrusting instead. If you would like to, you can read up about the severity of each murmur as well. Just remember that it is a common misconception to say that loud murmurs are severe. In general, complications follow this mnemonic PACE, which stands for pulmonary hypertension, atrial fibrillation, congestive cardiac failure, and endocarditis. Do take note that right and left-sided heart failures have different signs to look out for. We will be covering prosthetic heart valves in a separate video, but here we have complications that you can look out for in a mnemonic HUT, which stands for hemolytic anemia, endocarditis, anticoagulation, regurgitation, thromboembolism, and stroke. In terms of treatment, you can look out for features of bruising to suggest any over anticoagulation, and also scars such as sternotomy scars. Shown here are a list of things that you offer at the end of the exam. Do not forget this in your presentation. Sometimes I present the offer list immediately after my examination. Do not forget it. Always remember to time the atrial fibrillation for 1 minute at the end of the exam for the pulse rate of the patient. During the Q&A, you may be asked for a list of investigations that you would like to order for the patient. So here are standard ones as well as what to look out for. In terms of management, the examiners would like you to tailor it to the patient you have in front of you. You can start by giving some standard answers listed here. For example, employing a multidisciplinary team centering care on good patient education, cardiac rehabilitations, and so on. Think about other things you pick up along the way. Is the patient extremely breathless, unable to lie flat, and has signs of pedal edema? What about the pulse of the patient? Is it regular? You can then suggest specific treatments for symptom relief or managing the underlying etiology. Anyway, that's the end of the video. Thank you so much for watching. We hope that this video is helpful for you in your preparation for exams. Do give us a like below and leave us with comments on how it has helped or if there are any other topics you would like us to cover.